Hey Mocha Mamas, if you've ever found yourself confused by a late period and you were definitely not pregnant, then today's video is for you. In this video, I'm going to break down one of the most common causes of irregular periods, and that is PCOS, or polycystic ovarian syndrome. Let's get into it. Hello. Welcome if you're new here. I'm Dr. Tiffany Wittes, and I'm a wife, a mama, and an OB-GYN on a mission to eliminate women's health disparities. This channel was created to educate, elevate, and empower you to take back control of your health narrative. So if that sounds like something you're interested in, please be sure and subscribe below. September is Polycystic Ovarian Syndrome Awareness Month. In order to help us delve into what PCOS is all about, I thought we could start by taking a listen to the popular actress Lea Michele as she shares some insight into her personal struggle with PCOS.
This morning, actress and singer Lea Michele is opening up in the latest issue of Health magazine. The 33-year-old star revealing that she is living with PCOS, or polycystic ovary syndrome, admitting she stayed quiet about her health issues until now because there are way more extreme versions of PCOS that women have a lot of difficulty with, which is why I haven't talked about it. There are women who have it so much more intense.
PCOS is one of the most common causes of hormone imbalance in women, affecting about 5 to 10% of women. It's a condition where the body, specifically the ovaries, produce too much of the male sex hormone. Now, both men and women have the male sex hormone. It's just that in women who are affected by this condition, they are producing too much or more than the expected amount of the male sex hormone. Too much of the male sex hormone disrupts the hormonal pathway that controls your menstrual cycle. So this leads to the irregular periods, and in fact, irregular or infrequent absent periods is one of the hallmark signs of polycystic ovarian syndrome. This is happening because the body is not ovulating on a regular basis. Ovulation is the process that your body undergoes to produce and mature an egg that can then be released and fertilized if a pregnancy were to occur. This lack of regular, predictable ovulation is why PCOS is one of the leading causes of female infertility. Now, ovulation does occasionally happen, just not in a predictable basis, which is that 28 to 35-day cycle that we typically think of for our menstrual period. What does this mean? It is definitely not impossible to achieve pregnancy with PCOS, but it can be more difficult and might require assistance from one of my friends in the fertility specialty. Other common symptoms besides irregular or absent periods that women might experience with PCOS include acne or oily skin, increased or excessive hair growth in places where you would expect men to have hair growth, so the upper lip, the chest, the tummy, male pattern balding, which is around the temples or even thinning of the hair, darkening of the skin, and skin tags. We also know that PCOS increases a woman's risk for things like diabetes, high cholesterol, hypertension, heart disease. We see an increase in mood disorders such as depression, anxiety, eating disorders, sleep apnea, and uterine cancer. Now, it's important to note that we do not know what causes PCOS. The diagnosis of PCOS is made by taking a thorough medical history, performing a physical exam, evaluating blood work, and usually a pelvic ultrasound. Now, on this ultrasound, we're looking for that classic polycystic ovarian appearance, which is typically a larger than normal ovary, which has multiple small cysts around the periphery of the ovary. Periphery means outside. Now, we're not talking large cysts that you might think of typically associated with pain. These are small cysts that are millimeters in size and are not typically cysts that cause one to experience pelvic pain. Now, it's important to note that your diagnosis for PCOS should include evaluation that rules out other conditions that have features that can mimic PCOS. For example, thyroid disease, elevated prolactin levels. Prolactin is the hormone that allows us to produce milk, and then other rare but serious medical conditions. Okay, now let's chat about treatment. We'll start by listening to a little bit more of Lea Michele's story.
Star saying that changing her diet has helped her cope with the diagnosis.
Growing up in New York, she loved carbs and sandwiches and bagels. So since then, she's worked with her doctor to come up with a diet to really help fight those PCOS symptoms.
According to the U.S. Department of Health and Human Services, healthy eating habits can help alleviate PCOS-related symptoms, something Michele says she is mindful of.
Food is fuel. It's also for enjoyment. Trust me, I love a good meal with some wine and pasta and pizza. It's amazing, but you have to put good nutritious food in your body.
The star says she is now eating a lot cleaner.
I think it just helps so many women out there experiencing these types of symptoms or diagnosis and really giving them hope that there are ways to manage it and feel like your best self.
Now, it's important to note that there is no cure for PCOS. Treatment surrounds the management of symptoms that are associated with PCOS. Your treatment plan is based on what your goals are, which typically fall into one of three categories. Number 1 is symptom control, number 2 is achieving pregnancy, and number 3 is regulating your menstrual cycle. For those women who are concerned about the regulation of symptoms, implementing healthy eating habits as well as a regular physical activity regimen can definitely go a long way towards controlling the symptoms associated with PCOS. This is done by lowering blood sugar levels, optimizing your body's ability to use insulin, and to help bring your hormone levels back into the normal range. In terms of symptoms related to acne or oily skin, over-the-counter skincare products, or even seeking the care of a board-certified dermatologist can be helpful in this area. When it comes to controlling increased hair growth, we typically start with cosmetic hair removal procedures. There are also medications that can be taken to slow down hair growth. In addition, there are other medications that can be used to help decrease those increased levels of male sex hormones. When you're considering treatment options for the woman who's interested in achieving pregnancy, this again goes back to implementing healthy lifestyle changes, which includes a healthy diet and regular aerobic exercise. We know that just losing a slight to moderate amount of weight, which can be anywhere from 5 to 10% of your body weight, can go a long way towards regulating your menstrual cycles and improving ovulation, which will then improve your chances of achieving pregnancy. There are also medicines that can help improve ovulation. For some women, in vitro fertilization may be an option, or other surgical options as well. When it comes to menstrual regulation, the most commonly used medicine is a low-dose birth control pill. Now, this is an important point, and I really want you to get this. The reason this is important is because it's unhealthy for a woman who should be having a menstrual cycle to walk around on no medications that might be affecting her menstrual cycle and not be having a menstrual cycle. Why is that? The tissue that lines the inside of the uterus, the endometrium. So endo refers to the inside of the uterus, metrium refers to the uterus. If you are not cycling on a regular basis, that tissue can grow thicker, and potentially become unhealthy, precancerous. So by implementing medications that allow you to cycle at least every 3 months, you are protecting the uterus, decreasing a woman's risk for developing uterine cancer. Now, there are lots of other hormonal birth control options that you can insert here in place of that low-dose birth control pill. That includes the ring, the patch, the shot, and the progesterone IUDs. As an added benefit, these medicines can also help decrease acne and oily skin, as well as excessive hair growth. That's it for today, guys. I hope you found this video helpful. Let's continue the discussion in the comments below. Let me know, are you dealing with PCOS? Is there a particular treatment regimen that you found helpful? Were you surprised by anything in today's discussion? As always, I appreciate you. Take good care and stay healthy, friends. If you enjoyed today's video and want to see more like it, don't forget to subscribe. I'll see you on the next video.